Well, as the globe marks World Cancer Day today, focus falls on raising awareness of the illness in remote rural areas. This year's theme, Not Beyond Us, offers an opportunity to showcase the WHO's Global Action Plan for the prevention and control of cancer. Well, Professor Michael Herbst is the head of the Cancer Association of South Africa, and we chat to him now. Good afternoon, Prof, and thank you for your time on the PM News Desk.
Good afternoon to you and to all the viewers.
Expensive treatment for cancer patients, still out of reach for the majority of South African women. What needs to be modified about our health system to ensure that the poorest of our poor, those in rural areas, have a fighting chance against cancer?
You know, there's a lot that can be done. I think first of all is that money must be spent correctly. It would seem that somewhere in the health system, even though money may be budgeted for maintaining equipment, and I'm here referring to radiation machinery, or for medicines, and I'm here referring to chemotherapy drugs, it seems that it isn't managed well always, because we regularly get complaints that they're running out of stocks, and when you start asking questions, then they say the service providers haven't been paid. I think that is a major issue that we definitely need to pay some attention to, so that the poor people who are dependent, and that's more than 80% of our population, are dependent on public health services, and they are the ones that are taking the brunt of not getting the treatment that is really a human right.
Speak to us, Prof, on the need for a rigorous health promotion program with particular focus on rural women, taking into account, considering the economic hardships they face and often the inadequate healthcare facilities that they have.
Yes, absolutely. You know, there are people who live a few kilometers away from a basic primary healthcare clinic. And at that clinic, they don't always get the attention that they need. They do not recognize an early breast cancer, or there are no facilities to do a pap smear. And it is for this reason that the Cancer Association currently has 9 mobile units that we send out into the rural and far rural areas. And I just wish that we had the money, that we could have 3 or 4 mobile units per province, because there is a great need for us to go out into the real rural areas.
And extend your reach, of course.
And to extend our footprint.
Generally still, lower awareness levels in older rural women who are more likely to consult with a traditional healer about lumps in the breast, for example, or cervical bleeding. How do we get around this, Professor?
You know, there is still a stigma attached to cancer, where we know from experience, and as you rightly refer to the more older generation of women, that they are afraid that if they would go back to their families and expose that they've got breast cancer or cervical cancer, that they may be ousted from their families. This is unfortunately still in the remote rural areas a reality, and we must just really intensify our efforts to spread the message out in the rural areas, that people will understand not only the patients themselves, but the whole family and everybody who will be affected by a diagnosis.
Here at the SABC, we often don our pink ribbons, we run daily, monthly promos. Why are initiatives like this crucial, especially in the media? Absolutely.
Without those initiatives, the general public will not remain aware of the dire need out there. You know, as somebody, an organization like the Cancer Association, we are totally dependent on public funding. We don't get government grants to run our services. So we are really dependent on people continually being made aware that there is a great need out there, and we do this by wearing a pink ribbon, for instance, for Breast Cancer Month. And it is so important that people remain aware, and that they are conscious that there are people who are less fortunate than they are, and people that are in dire need for treatment and early diagnosis and intervention.
Prof, do you feel that this year's campaign will manage to get the desired momentum going, and how will you sustain it well into the new year?
Well, we've started this year's World Cancer Day for the next year by saying to the public, we're running an open day system at our cancer care centres. And we're inviting the public, please come and visit us. Not only today, because we've come to the end of today already, but from today on, come and visit our cancer care centres, see what we're doing, find a niche where you can fit in, and where you feel that you can become a volunteer, or where you would like to donate some money to extend a service, to provide 60 Rand that can provide enough funding for a pap smear for somebody in the rural area, or that we could get somebody housed, because when people are diagnosed, they have to come to the major centres for their treatment. They haven't got the money to stay there. And in our care homes, we provide board and lodging for these people free of charge, but it costs a lot of money. So look at these things and see if there's a niche where you can fit in. Companies, organizations, individuals, because every cent contributes toward making it a rand.
Thank you. Professor Michael Herbst is the head of the Cancer Association of South Africa. Thank you, sir, for your time on the PM News Desk.